is an ultra sling. After you have arthroscopy to your shoulder, you will wake up with the ultra sling intact. It has a cushion here that goes between your forearm and your body in order to abduct your shoulder a little bit. There are 3 points of attachment, 1, 2, 3, okay? And I just want to point out that there is a thumb sling. This is Velcro and is to keep your elbow secured posteriorly. And then there's also Velcro here. But when Grant detaches the sling, he doesn't need to worry about the Velcro. He's just going to detach these 3 points right here, okay? So watch Grant. 1, 2, and 3. And that should allow for the sling to come off. He's going to support his hand and let it slide out. Okay? In this position, he's going to allow his left arm to fully extend that elbow. Good. And keeping his hand on his wrist, he's going to flex it. Good. And at home, we'd like for you to do this 10 times. Perfect. Okay. Allowing for full extension and full flexion of your elbow. Notice that you're using your good hand to do all the work, coming up and down. The reason is because Dr. Talkington may have dealt with the biceps, and we don't want any active motion of the biceps. Last one. All the way down. Once it's down, he can relax. And in this position, shoulder shrugs. Up, back, and down. Up, back, and down. And up, back, and down. At home, we like 10 repetitions, 3 times a day. And the last motion that we recommend is go ahead and support your arm again, good, with your good hand. Grant's going to have a seat, supporting his arm on the table as he sits down, good. That arm can rest in this position. What I recommend is to bring that elbow back so that you have pure abduction. In this position, Grant can do his hygiene. He can rest. He doesn't have the sling on his neck. In this position, stay here for 5 or 10 minutes. You can have a cup of coffee, read, watch television, and you're getting good range of motion to that shoulder in this position. Those are the 3 motions: standing elbow extension and flexion, standing shoulder shrugs, and then seated with the arm positioned in abduction. Thanks.